Hello, and welcome to the ECISD Bloodborne Pathogen training. You are taking this training because your job description or job duties may put you in a situation that may expose you to bloodborne pathogens. The following ECISD job positions have been identified to take part in this training. Those positions include school nurse, athletic trainer, school nurse assistant, special education unit staff members, and anyone who is in a post-exposure state. Let's start off by asking, what is a bloodborne pathogen? Simply, a bloodborne pathogen is a disease that can be transmitted by exposure to contaminated blood. Examples include HIV, hepatitis B, and hepatitis C. Both forms of hepatitis are caused by viruses that attack your liver. A virus is a very primitive, very small germ that is invisible to the eye. These viruses can enter your body through a cut in the skin or through your eye or mouth if you come into contact with infected blood or body fluids. They can also be transmitted sexually. Let's look at each one of these separately. HIV. HIV attacks your body's ability to protect itself against disease. It is extremely dangerous. A person infected with HIV may show no signs of having it for years. People with HIV are at risk of developing AIDS, a condition that weakens your body's defense against disease. People with AIDS may come down with pneumonia, skin cancer, problems with the nerves, or other infections. There is no cure for HIV or AIDS, but there are medical treatments that can now prolong the lives of people with HIV and AIDS. HIV is spread through sexual contact, but may also be passed from one person to another through the blood. The other bloodborne pathogen we'll be discussing will be hepatitis B. This virus is one of the most dangerous infections you may face on the job. In some situations, it is up to 100 times more infectious than HIV. That's partly because there is usually a larger concentration of hepatitis B than there is of HIV in the blood of an infected person. In some settings, the hepatitis B virus can survive on a surface for at least 1 month at room temperature. Some people, called carriers, carry the hepatitis B virus without symptoms, but they can pass it on to other people. Others who are infected with the virus develop only mild problems. A smaller percentage may develop chronic problems. Some of these people may develop very severe problems and suffer liver damage, possibly even liver cancer. Here's some other signs and symptoms of acute and chronic hepatitis B. Fatigue and weakness, nausea, vomiting, abdominal pain and tenderness, mild fever, headache, jaundice, which is a yellow coloring of the skin or white part of the eyes, and muscle and joint aches. There is no treatment for hepatitis B infection, but there are vaccines that can prevent it. The last bloodborne pathogen we'll be looking at is hepatitis C. This virus is the most common chronic bloodborne infection in the United States. It is estimated that 3.9 million Americans are infected, and many of them have no symptoms, so they may not even be aware they are infected and can pass the virus on to other people. For some people, hepatitis C infection does not lead to any problems, but for many, hepatitis C infection leads to chronic problems. Infected people are at risk for developing chronic liver disease, which can lead to severe liver damage and even liver cancer. Many people with hepatitis C infection have no symptoms when they are first infected. Some people have symptoms that may include fatigue and weakness, abdominal pain, and jaundice. There is no vaccine to prevent hepatitis C infection. Implementing the OSHA bloodborne pathogen standards can help lower the risk of infection by reducing exposure. Bloodborne pathogens, including HIV, hepatitis B, and hepatitis C viruses, may enter your body in a number of ways. One way is when a sharp object that is contaminated by the virus cuts or punctures your skin. Examples of sharp objects are needles, broken glass, and knives. Another way that a bloodborne pathogen can enter your body is when a contaminated object touches inflamed skin or skin that has abrasions on it. Thirdly, another way that a bloodborne pathogen may enter your body is when you touch a contaminated surface and then touch your eyes, mouth, open wounds, or inflamed skin. The Edinburgh Consolidated Independent School District has a bloodborne pathogen plan. Some of the key points of the bloodborne pathogen plan include that the Edinburgh School District will provide at district expense, hepatitis B vaccinations to affected employees. If an employee declines to be vaccinated, the district must maintain a record of the employee's written refusal. The district must also provide to affected employees pre-service training and annual refresher training regarding bloodborne pathogens, transmission, personal protective equipment, and procedures, the kind of training that you're receiving at this time. The district will also log all sticks by needles or sharps in the healthcare setting as defined by the rules, and also provide for post-exposure evaluation and follow-up with any employee who has a sharps injury. A sharps injury is an injury that occurs whenever a contaminated or potentially contaminated sharp object punctures your skin, thus possibly infecting you with a bloodborne pathogen. A little more about the hepatitis B vaccine program. All employees who have been identified as having occupational exposure to blood or other potentially infectious materials are offered the hepatitis B vaccine at no cost to the employee under the supervision of a licensed physician or licensed healthcare professional. The vaccine is offered after bloodborne pathogens training and within 10 working days of their initial assignment to work unless the employee has previously received the complete hepatitis B vaccination series. Antibody testing has revealed that the employee is immune or that the vaccine is contraindicated for the medical reasons. Employees who decline the hepatitis B vaccine will sign a declination statement. Employees who initially declined the vaccine but who later elect to receive it may then have the vaccine provided at no cost. The Edinburgh School District will arrange with an outside provider to come to the district and offer hepatitis B vaccines at various times throughout the year. Your supervisor will notify you of upcoming vaccination dates. Next, let's look at procedures to follow in case of an emergency involving blood or other potentially infectious materials. If the blood or potentially infectious material comes in contact with intact skin, meaning there are no abrasions or cuts on the skin, then wash the area with soap and water immediately. However, if it comes in contact with skin with cuts, abrasions, then wash as above and see the nearest school nurse or coordinator of health services. It's also important for you to notify your supervisor immediately. If potentially contaminated material comes in contact with the eyes, immediately flush with running water for about 10 or 15 minutes. Also, once again, notify your supervisor and see the nearest school nurse or coordinator of health services. To avoid contamination with bloodborne pathogens, it is very important that everyone follow universal precautions. Universal precautions are to be observed by all Edinburgh CISD employees to prevent contact with blood or other potentially infectious material. What is universal precautions? It is a name that the Centers for Disease Control and Prevention uses to describe the practice of treating all blood and other body fluids as a possible source of contamination and infection regardless of perceived status of the source individual. Body fluids that require universal precautions include human blood and any products that include human blood or parts made from human blood, semen, vaginal secretions, cerebrospinal, synovial, pleural, pericardial, peritoneal, and amniotic fluids, saliva in dental procedures, any body fluid that is visibly contaminated with blood, any unidentifiable body fluid. I want to stress again the importance of universal precautions. Once again, universal precautions is treating all blood and body fluids as if it is infected. Doing so would certainly lessen the likelihood of you coming in contact with any bloodborne pathogen. Treating all blood and body fluid as potentially contaminated is important. So too is the use of personal protective equipment. Disposable gloves are probably the most common personal protective equipment, which we'll call PPEs. Disposable gloves should be made available to you if your job requires their use. Please talk to your supervisor about acquiring disposable gloves and acquiring the correct size of disposable gloves for you. Other examples include masks in combination with eye protection devices such as goggles, glasses with solid side shield, or chin-length face shields are required to be worn whenever splashes, Spray, splatter, or droplets of blood or other potentially infectious materials may be generated, and eye, nose, or mouth contamination can reasonably be anticipated. The PPEs are designed to protect you. However, in some cases, they lose their protective state. An example is a disposable glove that no longer offers protection because it is torn or it's used. Please dispose of all disposable gloves after they are used or tear. Inquire about proper cleaning of surfaces and equipment. Discuss this with your supervisor and or any janitorial or custodial personnel. It is important that you dispose of gloves after use when they tear or no longer offering you protection. Also, cleaning of surfaces and decontamination of surfaces can be done either immediately after completion of procedures, immediately after the end of the work shift, and immediately or as soon as feasible after any spill of blood or other potentially infectious materials. And it should go without saying that washing your hands should be completed after removing gloves and or coming in contact with potential infected material. Hand washing is foundational. It has been shown to be the most effective way to prevent the spread of any disease. Please wash your hands. Other reminders. Please be sure to place used needles and contaminated sharp items in sharps containers that are located in all school nurses' offices. Sharps may be contaminated after assisting a student with an insulin shot or helping a student take a blood sugar reading. All of these items are sharps. Please be sure to place used needles and contaminated sharp items in sharps containers located in all school nurses' offices. Please also do not pick up broken glass with your hands. Call a custodian. They'll be able to sweep up the broken glass and dispose of it properly. Also, double bag contaminated non-sharp material. Place that in a plastic bag and place that bag in a plastic bag. As I've mentioned before, decontamination of surfaces can be done immediately after completion of procedures, end of work shifts, and whenever there's been a spill of blood or potentially infectious material. And now, what to do if you believe that you have been exposed to potentially contaminated blood or body fluids? When the employee incurs an exposure incident, once again, an exposure incident is one in which you feel that you have come in contact with potentially hazardous blood or body fluids and has either gone to your eye, your mouth, or a break in the skin. That would be an exposure. The employee reports to the nearest campus nurse or coordinator of health services. All employees who incur an exposure incident are offered a confidential medical evaluation with a physician and follow-up at no cost to the employee through the district's workman's comp insurance plan. An employee incident accident report will also be completed. The employee will be directed to the district workman's compensation office for a physician referral voucher. If the incident occurs outside of normal business hours, the employee should seek immediate medical attention and notify his or her supervisor. And the employee incident accident report will then be completed as soon as feasible. The campus nurse or coordinator of health services will complete a Department of State Health Services contaminated sharps injury reporting form and submit it to the Hidalgo County Health Department. A copy of the report will be forwarded to the Health and Human Services Department. The employee is offered post-exposure prophylaxis in accordance with the current recommendations of the U.S. Public Health Service at no cost to the employee. The coordinator of health services is designated to ensure that the policy outlined here is effectively carried out and records are maintained. A complete and detailed copy of the ECISD Bloodborne Pathogen Plan is located in all school nurses' clinics and the offices of all department heads. If you have any questions, please visit the nearest campus nurse or the district coordinator of health services. Thank you.